Good afternoon, you guys. It is Amy Vanderlinden back with another episode of Change the Conversations. I'm really excited today. We're talking to a friend of mine, Justine Calderwood. She's a fellow pelvic PT. She's a fellow MFR lover. We are both Johns Barn trained myofascial therapists and very much in love with this work. We also happen to share a mastermind group and just a lot of fun and sometimes not so fun journeys in business that we've been able to call each other and commiserate and encourage. And I just really value our relationship. So thank you so much for taking the time to chat with us today. Why don't you tell everybody a little bit about yourself?
All right. Yeah. Thanks for having me, Amy. It's a pleasure to be on here and just kind of talk to you as a friend and colleague and entrepreneur. So I have been a physical therapist for the last 21 years as of today. And I have a private practice here in Colorado Springs that I focus on women's health and myofascial release. And that's kind of me in a nutshell. I see a lot of pregnant and postpartum moms, to be honest. I'd say 90% of my clientele are pregnant, postpartum in some way. Most of them are recently postpartum, but I also see some older ladies as well that maybe don't consider themselves postpartum, but they certainly are because they've had kids. But yeah, I do that primarily. And I'm here to talk about, changing the conversation around some of that postpartum and also prenatal healing and fitness, so to speak. So wellness.
Awesome. Yeah. And I know hear a lot of buzzwords thrown out, right? Like core and pelvic floor and diastasis or diastasis recti. And I know a lot of our clients are confused about some of those postpartum recovery things. I know, like us, you guys talk a lot about common versus normal. So it might be common to have pain with sex after delivery, or it might be common to leak some pee, but it's definitely not normal and it's treatable. And I'm really excited to even learn from you today some about the hypopressives work you've been doing lately. So yeah, kind of tell us about your approach and how you got into that, and then what you've been learning lately about hypopressives. I can't wait to hear more.
Yeah. So let me just start from the beginning. I am a certified low pressure fitness trainer. So hypopressives are kind of a general term for this type of training. It's a whole body training when it's done, say, through low pressure fitness. So I don't know all the history with that, but I have learned from the co-founders of Low Pressure Fitness. There are two Spaniards. Tamara Rial is one of them that I've learned directly from her. And then I don't know if I'm going to say his name right, but Pitash. I don't know if I'm saying that right. Never met the gentleman. I honestly don't know if he even speaks English. But I've learned directly from Tamara and also two of her master trainers through Low Pressure Fitness. And they use hypopressives to help get that core and pelvic floor, the deep core and pelvic floor strong, but it really is a whole body training system. And I got intrigued with this from some of just classes I was in for pelvic floor physical therapy. One of the gals that I was taking a class with several years ago was doing hypopressives, and she was really sharing, even in our class, about how it was helping a lot of her clients with diastasis. And I got a little intrigued. I'm like, So I kind of started following her a little bit on her social media and YouTube, and I could see her making videos where you could really see the gap closing when she was having her patients do hypopressives. And so it kind of planted the seed of my interest in it. And then, quite honestly, I started having patients ask me about it. They're like, hey, do you know hypopressives? And so I knew that was my kind of nudge from the universe to do some more training. And in fact, once one of my patients ended up doing some training with Trista. I can't remember her last name, but she is directly has trained with under Tamara as well. She's from Canada. And so when one of my patients seeked out this other, I think she's a maybe a personal trainer, and she started working with her virtually, I knew at that point I needed to do something to better support more of my patients, because I'm like, okay, they're looking elsewhere now. So around that time, I started looking into training. Well, then COVID hit, and it kind of, like, as everyone knows, like, life changed, right? But with that, what I had found prior to COVID is that these classes were only offered in person. And busy business owner, PT, mom, I was like not finding the perfect time in order to attend one of these classes. Well, because of COVID, they actually started offering low pressure fitness training online. So at the end of 2020, I started with level 1 low pressure fitness training, and then I finished it up the first part of 2021. And was able to go through all 3 levels. And now I'm a certified low pressure fitness trainer. So I've gone through those 3 levels and then the certification exam. And there's even more, like they're developing even more. So with that, I found that because the co-founders were from Spain, this is huge, actually. Hypopressives, low pressure fitness is huge all over Latin America, all over Spain. Like, they told me actually in my training, they're like, over here in Europe, you can find low pressure fitness studios all over, kind of like in the United States, how you see yoga studios all over. Like, everybody knows what yoga is. There's a yoga studio like on so many corners, right? But you will be hard pressed to find anything with low pressure fitness in the United States. Like, it's up and coming, but it's not as well known as, say, yoga, where it's the opposite over there. They're like, you'll find a lot of low pressure fitness studios and you'll find very few yoga studios. And so, yeah, with that, I have found that to maybe I haven't found that to be true personally, but when I start doing like searches on YouTube for even like low pressure fitness, so many videos come up in Spanish, which, lucky for me, I speak Spanish, so it's kind of fun to to learn that. I don't know it well enough to have done my training in Spanish. I really needed to do that in English. But anyway, that's kind of how I got started with low pressure fitness. It was really a drive from my patients and a desire to learn from the person that was actually teaching it, not learn from another person. I mean, it's kind of like why I wanted to learn from John Barnes, right? With myofascial release. I don't want to learn from somebody that learned from John Barnes or is doing their own flair on it. I like to go to the source when I do my training. So that's what got me into that.
One thing I'm
And
curious
then,
about, because oh, sorry to cut you off.
Mhm.
So I know we're both extremely passionate about Barnes myofascial work, and that's a manual technique where hands-on, connected, working on the tissues, the connective tissues, the fascial layers, all of that. Hypopressives, to the best of my understanding, is more of a breath related exercise movement pattern. So how have you incorporated the two? How's that worked out in your practice?
Oh, it's worked out really well, actually, because once I started the training, I realized how much kind of explained to my patients. It's kind of like a movement, an exercise way to target the fascia, because it does start with the breath. That hypopressive breath is kind of the hallmark of low pressure fitness. But what it is, because it's a whole body training, we're moving the arms and the legs. We're getting into different poses, similar to yoga, right? But they have their own unique poses. But we're actually helping to open up the nervous system. Okay, we go into like ulnar, radial, median nerve stretches, sciatic nerve release. And because we're really using that breath and the awareness and our movement, it's very slow, controlled movements when we're moving. We're allowing that fascial system to actually lengthen out and help it to be more mobile. So, I mean, again, you can talk about the nervous tissue or the nerves, but as we both know, you cannot separate out the fascial system from that. So I love it for that reason, because to me, it makes so much more sense now that I've had the training and I do this training for myself, and I also work with my patients on it. It's a really wonderful way of exercising.
That's amazing. So yeah, I didn't realize there were entire full body movement patterns with it. I really was only aware of the piece for the core activation and the breath related intake. You had mentioned being able to do a little bit of a demo for us. Are you ready to do that? Or do you
I
need to
think so.
explain
I
more
mean,
first?
yeah, so I will I'll do a demo so you can kind of see what it looks like, because I think that is the hallmark of whether you call it hypopressives or low pressure fitness, but seeing how that vacuum effect is into the abdominal area, it really helps you to kind of see how that can help lift up the organs. We get a cinching of the waistline, and really we're getting that diaphragm to move. It's about that diaphragmatic breath, and the mobility through that rib cage is kind of the center of it. So yeah, let me give you a demonstration here so you can see what I'm talking about. I'm just going to bring my shirt up. I do have a sports bra on, so you can kind of see here. And so I'm just going to show you this. I'm not going to go through a whole like pose or sequence or anything, but I will talk about that. So I want you to just kind of see here. I'm going to do some breaths. And typically when we start out with beginner poses, should I move back so you can see my face?
Either way, I think
Okay.
you'll be able to get the point of what you're
Oh, I'm
teaching.
here. Yeah, you'll be able to see it better. Okay, so I'm going to do 3 breaths. And what I want you to do is see as I'm breathing, as I inhale, kind of this expansion through the rib cage. And then as I exhale, it coming back down and kind of recoiling. And I'm going to do that 3 times completely. At the end of that 3rd breath, what I'm going to do is actually hold my breath. So you might see me, I'm going to like to pinch my nose. I don't do this when I'm doing my own training, but when I teach patients, this is how I teach them so that we get a nice good seal of the glottis, so we're not getting any air exchange. So I'll hold my breath, and then I'm going to take like a false breath in, and you will see kind of a contour up here around my rib cage. And I'm going to turn to the side once I get there so that you can kind of see the cinching in of my like multifidi, like my back muscles, and then also this like activation of the transverse abdominis muscles. Okay. All right. So here we go. I'm going to put my hands here. I just want you to watch. So inhale number 1. Okay. And I just kind of pause. It's nice and slow. Exhaling now. 2nd breath. Okay. And exhaling out. 3rd breath. I'm going to go through that again. I'm going to exhale out completely. Hold my breath. I unpinch, and then I have to take a breath in and exhale out. Did you see that okay?
Yeah, it was a good demonstration. Yep.
Yeah, so with this, it's what we start with is we have to start with the breath. I explain to my patients, it's kind of like we're building a house. We have to get the good foundational breath. We have to get good mobility in the rib cage, good proprioception. The brain can connect and go, okay, I know how to use those muscles. So we start with that. Then we start to build on top of that, and we start to do poses. So this can be done in different positions. So for instance, with my patients, I like to start with them on their back because there's less moving pieces. But we get the body set up from the feet up to the head, and we get the arms, like the shoulder girdle, to open up. There's a couple different positions we use with the arms. We have these straight Venus arms, we call them. Otherwise, we have these Athena arms. And we do it in different positions, symmetrical, asymmetrical. But really why we're doing that is we're opening the shoulder girdle up and allowing the serratus anterior muscles to engage to get better lift of the rib cage and better lift of that up and expansion. So we can do this lying down on the back. We can do this on hands and knees, kind of going through those developmental sequences that we know as a PT that are very functional in our everyday life. We do this sitting up. We can do it standing. We can do it in different positions where we're lengthening out and getting those fascial tissues, those fascial layers to open. And your whole body's working because you are kind of holding, in a way, almost like a tense contraction, and everything's working because there's just, you do in these different postures. What I love about it too is it does translate into everyday life. What I have found, me personally practicing this and with my patients, they'll start to tell me they have better awareness of their body, better kinesthetic awareness of where their body is at in space and what good posture is. And now we've trained the body in that position, so it becomes easier for them to stand up without kind of slumping over. They learn how to find pelvic neutral. They learn not to lock their knees out. They learn how to get this axial extension and lengthening through the top of the head and the shoulder girdle activation. So we are doing all of that. The body's getting stronger. It's learning those better positions, and it's great. It really does carry over into everyday life. I could go on and on, but I want to tell you one thing that I love to do with this is how I've incorporated this into my practice is for specific, diagnoses. I can get down to the like that very cellular level, so to speak. But what I have found is I can do this as like some of my patients come in and we might do some manual work. And then I'm like, okay, let's do maybe 20-30 minute kind of sequence. I'll teach them these different poses and how to move and transition from one pose to the other, because it's meant to be a flow, kind of like yoga, right? Meant to go from a standing position. How do we get to the floor? Okay. So we might do that exercise to incorporate some of that manual work I've done with them. For other people, I might show them very specific pose to help them with something like their prolapse. And I'll say, okay, I know for you at the end of your day, you're feeling really heavy, or after taking a walk and you're pushing that stroller, you're feeling that pelvic heaviness. I want you to get down into hands and knees, and even in kind of an inverted position, either on their forearms, or there's a pose where they're kind of like opening up on their forearms and their head down. And that gives them in that position where the organs are now, and gravity's kind of helping them, and they're also strengthening and allowing that to happen through that hypopressive breath. So it can be, pieces of it can be taken. There's times where people come in and I know they're not ready for all the things, but I'll just say, you know what, let's stand you in front of my mirror here. I'm going to show you, and just line them up with everything except for the breath, except for the hypopressive breath. I'm teaching them what is good posture. And that's the first step for me to then take them into low pressure fitness when they're ready. Okay. And yeah, so I get to decide and kind of lead my patients what's appropriate for them. For some of my patients, they don't like low pressure fitness. And I know that's not something that they're going to continue with. So that's okay. I don't push it, but I might use elements of it to help them get to whatever goal they're looking for. So yeah.
Definitely have a question. So
Yeah.
we talk a lot about how diaphragm and pelvic floor, you inhale, exhale, they go together.
Yeah.
And so not wanting to kink the canister or create excessive intra-abdominal pressure is a phrase we sometimes use. So maybe explain to our listeners, it seems like that suctioning in could potentially create a lot of extra pressure. Explain how the low pressure fitness doesn't do that. Cause I think that's one misconception I've heard about low pressure fitness or hypopressives, especially I think just that word hypopressive sounds, even though hypo is less, it just sounds kind of intense. It sounds a bit, I don't know if that sounds aggressive, but it sounds intense, hypopressives. So explain a little bit about that pressure system and how it actually is meant to protect that feature.
Yeah, you're actually, when you do the hypopressive breath, you exhale out. So you don't like the breath is actually out. It's not in there. Like when you inhale, that breath's coming down, right? Regardless, we know that the diaphragm moves down, all that stuff, right? But when we exhale, it's gone back up, right? And so what happens is you're creating this seal. So you're not letting any air come in anymore, and you're holding that breath. And what happens is it suctions up. It's got nowhere to go except into that rib cage and the diaphragm to open up. So you're not pushing down in any way. And it actually lifts the organs up. So they've done studies on this, and I don't know all the studies, but I know it's been part of my training. And they, like Tamara Rial she's a researcher. That's what her whole research for many, many years has been around this. So I can get you that if you're a researcher and you need all the proof. But they've done even ultrasounds and EMG and that, and you can even see how those organs lift up. There's some really good videos that she has, even showing right at the introitus, right at the entrance of the vaginal opening, a cystocele sitting there, like grade 3, grade 4 cystocele, and you can see that. And as the person does the hypopressive, you can see how that moves up, and the bladder actually moves up out of the way, and it's not there. Okay. And then as she inhales, it comes back down. So it's not really meant to be like, okay, it's going to keep those organs up, but it can help to, make some changes with that. So no, it's not an increase in pressure in any way. If you're doing it wrong, possibly,
Yeah.
but it really was meant as a way to give an alternative to traditional exercises, core exercises, which oftentimes does increase pressure if they're not done properly and without awareness. Yeah.
Yeah, I think that whole belly button to the spine thing went way too far. And that can create a lot of intra-abdominal pressure, especially done incorrectly or overdone. A lot of us overdo our movements, our engagements, or our core things, and can contribute to that pressure, which could make a prolapse or diastasis or some of those things worse. So super helpful info. Hopefully that came across clear to everybody. I felt like it was really clear. So what's your next favorite thing that you're going to be incorporating or looking into more?
So I'm actually in the process right now. I'm getting ready to launch some live classes, and I'm incorporating
Amazing.
low pressure fitness. Yeah, but I also incorporating some of the myofascial work, because that's what my patients have told me. I've done some classes in the past, live classes, and it's been geared more towards like using the little myofascial ball and how to use your hands, maybe foam roller, not rolling out, but for positional. Like I developed classes in that way to help that mobility and pain relief. And so what I'm doing is kind of blending some of that. How can we still take care of our fascial system and kind of slow down and allow the mobility? But I'm also blending it in with some low pressure fitness. And then also I know, just based on experience with my patients, again, not everybody loves low pressure fitness because it's new, it's technical, it's hard to get a hold of sometimes, or grasp the concept of it. I get that. So I'm also doing some traditional kind of strengthening with that as well, but really geared towards postpartum moms. So I'm getting ready to launch that here in the next month, to do some live classes. I love to teach. I think us as PTs, we teach all day long anyway,
Yeah.
but I love to guide with that. So I'm going to be teaching some live virtual classes. I've called them Fit to Be. Basically, they're designed for moms that want to fit to be mom, fit to hike, fit to run, fit to be whatever, be as active as they want to be. And I'm going to be teaching those here on Friday mornings, 8 o'clock Mountain Time. And yeah, so I'm kind of gearing up towards that as an
That's
entrepreneur.
amazing.
Get all my ducks in the row for that. So I'm
I'm so
excited.
excited for you on that. That's really incredible. Good for you. Proud of you.
Thank
Um,
you.
so what if somebody hasn't had kids and they're listening to this and they're thinking, or a male, and they're listening to this and going, is this even matter? How would this be relevant to me?
Yeah, totally relevant. You do not have to be a mom. It's just, that's kind of my, what my clientele is. I'm also a mom, so that's kind of where my mind is. But no, men have pelvic floor, men have core. This is definitely something that can be done any gender. You don't have to be a mom, and also it can be done during like pregnancy. Except we can't do the hypopressive breath. We can't hold the breath and do that. But there's a lot of elements that low pressure fitness offers even during pregnancy, because of the posture, and the awareness of that core and pelvic floor. We can go through the breaths. It's still important that we try to breathe in with that diaphragm. We just can't do the hypopressive breath. And there are some precautions with low pressure fitness. I mean, not 100% population is safe to do it. So I won't go into all that, but like if you have high blood pressure, for instance, uncontrolled high blood pressure, we don't want you holding your breath. If you've had abdominal surgery, C-section, we want to wait a amount of time where those tissues can heal. So we don't start that we can start at 10 to 12 weeks post-op. But again, elements of this can be done even earlier. We just can't do the hypopressive breath. We have to take caution with certain populations and certain diagnoses. But the things that I see on a regular basis and that you see, diastasis, prolapse, incontinence, back pain, neck pain. Again, if we can teach people to breathe down here, how much can we take the tension off of their neck and help with migraines and headaches and things like that? So yes, there's a lot of people that can benefit from this.
That's amazing. Yeah, I know I talked to a lot of the guys and other people at the gym about pelvic floor and how better breath and teaching, we call it filling and emptying breath, but making sure those tissues relax fully. And so that's one thing I love about the little bit I've learned about hypopressives is, to me, it fits with what we teach for filling and emptying breath, for reverse Kegels, for expanding.
Mhm.
And we definitely bang the awareness drum too of knowing your own body, being able to look inward, feeling those places of tension. So it definitely seems like a great addition to all of those kind of philosophical alignments too. But yeah, men, absolutely. You guys have a pelvic floor, and
Mhm.
having a better awareness, connection to, and activation of your core and pelvic floor can 100% improve your health, can help decrease, especially if you're getting older and noticing you pee at night too much, or maybe having some other struggles that, um, you know, that's fixable and treatable, and doesn't necessarily mean, I mean, tension can build up for so many reasons. So definitely doesn't necessarily mean there's something wrong with your prostate, or for women, definitely doesn't necessarily mean you have prolapse. Um, so I know we're very passionate about education, and I think this is great because it gives just another aspect of knowing our bodies, strengthening our bodies, and improving breath. That helps with all aspects, really. So
Yeah,
love what you're
yeah.
doing with that.
Yeah, I mean, even just learning that breath, right? And how that can start to bring that awareness into your body instead of being up here and, letting those thoughts race and that kind of thing. So yeah, sometimes I just use that element of it. And maybe I don't take that patient into, low pressure fitness all the way, but it's got so many benefits. Yeah,
Oh, and
absolutely.
yeah, I love the combo with the expansion. Again, I didn't know there was the full body movements that it moved into. I was just aware of the breath patterns and the suction piece related to pelvic floor. I
Mhm.
had heard about that and learned a little bit about that, but um, the expansion and being able to, like you said, our nerves, our blood vessels, our lymph, all of it sits within the fascial system down to the bones and each individual cell, the ability of the body to for the cells to communicate, for tissues to have fluidity throughout the body, like all of that is impacted by our fascial system. And yeah, you're intriguing me to go want to take some
Yeah.
classes.
Yeah, come on in. Well, and you can I can give you some resources too if you want to possibly for men. I mean, the classes that I'm going to be teaching, I'm gearing it towards that, but as long as a male felt comfortable coming into class, I have no problem with that. But all of my marketing, all that stuff is kind of geared towards the postpartum mom, just to kind of narrow things down. But I mean, there's resources out there. There's people teaching men and both genders at the same time, that kind of thing. So yeah.
Well, so if some fellow practitioners are listening, where would you point them if they're wondering about more resources?
I would definitely look up Tamara Rial. And I did my training through Pelvic Guru. I did it through them, Pelvic Guru Academy. I can't speak right now on what they have available still through that, but that's what I did through my training through. And then the other two resources, like my mentors, the low pressure fitness like master trainers that I highly recommend look into is Becky Keller from Elevate Core Health. She's based out of New Jersey. She's a pelvic floor PT, kind of turned to exclusively, I believe, at this point, doing low pressure fitness. She's going to be talking at, from what I understand, APTA, a meeting coming up, like combined sections, or I don't know exactly.
Yeah.
But she's a great resource. She teaches the trainings. And then also Alexa Marine. She's based out of the UK. She's actually from Spain as well. But those three ladies, powerhouse in teaching this and doing the trainings. And they have some hybrid courses where you can learn online like I did. And also they're back to teaching stuff in person. So whatever way that works for you, there's offerings around the United States and international as well. I know Becky actually just went to Poland to teach there. They've been to Mexico recently as well. So yeah, you can go learn however style you need to or whatever way.
Maybe we can incorporate that if we finally get our Costa Rica retreat together.
I actually told them, I'm like, hey, you guys need to have a low pressure fitness retreat in Costa Rica. And they said, oh, we don't have one there yet. I said, let's do it.
Yeah, let's plan it. We've been working on it. It's a dream of Justine and I's to go do a retreat in Costa Rica. It's not looking great for 2024, but we definitely need to nail some stuff down for 2025.
And I kind of want to.
Fall wasn't the rainy season. Yeah, like if fall wasn't the rainy season, but.
Well, I'm like, I kind of want someone else to plan it, and I just want to attend, you know, like we got all our stuff that we're doing with our businesses that this is nice. You plan it, I'll throw money at it, I'll come.
Sweet. Well, yeah, keep planting those bugs in their ear. One way or the other, we will have a retreat, be at a retreat, go to a retreat, do something.
Yeah, exactly.
That's awesome. Well, as everybody knows, this podcast is called Change the Conversation. And so we've already talked about pelvic health and myofascial work and all the things we have in common. But what is your passion project? Where do you feel most lit on fire about changing the conversation in your current work right now, Justine?
I don't know how to answer that. I don't know, honestly. I think for me, it's as a business owner, I want to do some online stuff, and that's kind of where I'm heading. So that's where I see my future, and being able to do some maybe coaching / training, reaching people that are beyond just my geographical area. I'm doing a pregnant and postpartum athleticism certification coaching through Brianna Battles right now too. Yeah. So I'm kind of curious on how that's going to incorporate, you know, maybe it stays in the treatment room here and I use it here, and maybe I bring that online in time eventually as well. So we'll see. Time will tell.
Well, share with everybody the name of your business and where they can reach out or connect with you, especially if we've got any listeners in the Colorado Springs area. Share that with us, and we'll put all this stuff in the show notes. You guys, I'll also put Pelvic Guru and those instructor names that she listed. But where can they find you, Justine?
So I'm at the Healing Spot Physical Therapy in Colorado Springs. My website is healingspotpt.com. I can be found on Instagram at healingspotpt and also on Facebook, Healing Spot PT. And I'm sure if you just Googled, you can find me on YouTube as well. I create some videos as well. Yeah.
Awesome. And stay tuned to your website for the online courses.
Yep. It'll be on my website and of course on social media. I'll be pushing it there as well.
Of course.
Yeah.
That's exciting. I'm really excited for you. Doing big things, lady. I appreciate you sharing with us about hypopressives and expanding my view of what they are for sure. Any last words you want to share with our audience?
Yeah, I want to say, like, in the low pressure fitness world, we say kind of it's beyond hypopressives, because I think, like I said, hypopressives kind of gives you that, you get the hallmark breath and you see it, but I don't know the whole kind of like origin of hypopressives, but I do believe, what I do know is that Tamara Rial and Panache, I don't know. They were maybe friends at one time and they just had different kind of opinions on how to take that. And so I'm kind of a low pressure fitness girl that they really do the whole body with that. So I can't speak for just strictly hypopressives, but we do like to say it's beyond hypopressives with low pressure fitness.
That's amazing. We'll make sure that comes across super clear in this episode as well. And like I said, you guys, will link stuff in the show notes so that you can find more resources if it's something you're interested in. And bottom line of our messaging is no settling, no suffering, no shame. We especially want women to have a lot more confidence in their bodies, feel healthy, feel whole, feel capable. And there's lots of ways to get you there. So just know there's more and more resources. That's what I'm here to educate about. And we'll talk to you on the next episode. Stay tuned, like, share, press the buttons, do the things, you know, and we'll see you soon. Thanks again, Justine. I appreciate it.
Thank you so much.